Hi, my name's Kristen. I'm going to be your nurse today.
Hi, nice to meet you.
Nice to meet you too. So I heard you've been having some abdominal pain.
Yeah, I'm having some sharp burning pains in my stomach for about a week now.
Okay. Let's see if we can figure it out. Do you mind if I ask you a few questions?
No, go ahead.
Okay. First of all, what's your name and date of birth?
John, 4/29/1960.
Okay. And are you presently experiencing pain right now?
Yes, it feels like a knife's like going through my stomach right now.
Okay. Can you rate that on a scale of 1 to 10? 10 being the worst pain you've ever felt.
It's about an 8 right now. It hurts, but it's like bearable.
Okay. When did this pain begin?
Well, I got a lot of bloating and gas after I eat at night, and I get bad heartburn. I have a constant ache unless I'm doing like strenuous exercise or I eat like unhealthy foods. The sharp pain lasts about like 2 to 3 hours, and it finally starts to subdue, but like never completely, so it's always there.
Okay. Can you tell me what area pain is in, and if it radiates or changes location?
It kind of goes all over, but like mostly just like under my belly button. It's like sharp pains, but then it's just like a burning feeling in general.
Okay. How long does that burning feeling last?
Usually 2 to 3 hours, I would say.
Okay. And is there anything that makes the pain feel better or worse? Certain times?
Well, it gets worse with strenuous exercise. Actually, after work, I'm a package delivery carrier, so I pick up packages that are like 50 pounds and heavy every day for me. I never had a problem until now because it makes my stomach hurt worse.
Okay.
And when I have a drink or two after work, I notice my stomach begins to hurt worse, especially like eating spicy foods or fried foods like make it hurt more too.
Okay. I'm glad you're giving us so much information. Along with the increased pain after eating, have you had any other symptoms like vomiting, nausea, or loss of appetite?
No, not really. I'm pretty okay with that stuff.
Okay, that's a good sign. How about any weight loss or weight gain? Have you noticed any changes?
No, my weight's been like about the same. I kind of have been like eating less though, but other than that, it doesn't have affected my weight.
Okay, and you're eating less because of the increased pain, right?
Yes.
Okay. How about any previous abdominal surgeries or injuries?
I don't have any injuries, but 5 years ago I had a colonoscopy. I think I had about 6 polyps removed, and they made sure that they weren't cancerous.
Okay, no cancer is always a good sign.
Basement door.
Have you experienced any previous abdominal pain similar to this?
I mean, sometimes I get normal gas pains that always go away within a few hours, but this time it's like hasn't been going away.
Okay. So how about do you know of any family history of any, stomach cancers, colon, liver, anything like that?
Well, my mom died of stomach cancer, so I think it runs in my family. And my dad had prostate cancer, but the doctors have been treating him with these proton therapy treatments, which seem to be helping him a lot.
Sometimes stomach cancer can be genetic, so it's really important to know the signs and to get screened for it, just so you're aware. Has anyone in your family ever had appendicitis or any serious abdominal issues or like colitis or hemorrhoids or anything?
Not that I know of. My mom had a lot of pain with her cancer, but that's about it.
Okay. I'm just going to move on to lifestyle questions, if that's okay.
Yep, that's fine.
Okay. Do you smoke or drink?
I don't smoke, but I drink once in a while, like after dinner and after work.
Okay. And can you give me like a rough idea of what you eat in the last 24 hours?
Well, I had some cereal before work, a sandwich at lunch. I had some fried chicken at dinner, and with some beers, and that's usually when my pain starts.
Okay, so it sounds like the food and alcohol might be a trigger to your pain. Do you use any medications or antacids that might upset your stomach?
No, not that I think of. I just have take pain meds for my back once in a while, but
Yeah.
other than that,
Okay.
nothing major.
Okay, great. We're almost done. Do you have any stress in your life currently that might be affecting your eating patterns or elimination patterns or anything?
I mean, I stress at work. We've been really busy lately. The stomach pain is really stressing me out and worrying me.
Okay. Hopefully that won't be a problem for too much longer. Thank you for answering all my questions. I'm just going to discuss everything with another nurse, and she'll be in to give you a physical exam.
Okay, thank you.
And I have a gown for you. I'll just give you some privacy to put
Okay.
it on.
Thank you.
You're welcome. Hey, Tiana.
Hey,
So I just finished a history on one of our patients, John, a 55-year-old with abdominal pain. He said it was an 8 on the pain scale, so he's in some serious pain. And he gets a lot of bloating and gas after he eats, and it worsens when he's exercising at work and when he eats fried foods, spicy foods, and drinks alcohol.
Okay.
So he hasn't had any previous abdominal surgeries or anything, but he did have a colonoscopy and had 6 polyps. So that makes us to know. And he doesn't smoke or anything like that. He's stressed at work and doesn't take any medication. So just if you want to do a quick abdominal assessment on him, and then maybe we can make some referrals.
Okay, that sounds
Okay. Thanks so much.
good. Come in.
Hi, I'm Tiana. Can I just have your name and date of birth?
John, 4/29/1960.
Okay, perfect. All right, so I hear that you're here for some abdominal pain.
Yeah, it's been like sharp, like burning pain all through my stomach.
Okay, so we're just gonna do an exam, and we're gonna look and see if there's any like distension or anything like that where you're feeling the pain. Okay?
Okay,
So can I just have you lie down? All right, I'm just gonna lift up your shirt, and then I'm gonna go over this side, quick. Look closer. All right, so right now I'm just looking for any inspection. I'm just inspecting, looking for anything. I'm seeing a little distension in this area. Is that where you're having your pain?
Yeah.
All right. So, all right. I don't see any abnormalities or anything besides the distension. Okay. Now I'm gonna auscultate, and we're just gonna listen to your bowel sounds. Okay. Okay, your bowel sounds sound good. Now we're going to listen to some vascular sounds in your aorta, your femoral, and your iliac. And we're also going to listen to some friction rub with your liver and your spleen, okay? So everything sounds good. I'm not hearing any friction or no bruits or anything like that. All right. Next, we're going to percuss, and you need to tell me if there's any pain. Okay? I'm hearing a little bit of hyperresonance down in this lower area. Do you feel anything? Any pain?
It's just a little tender when you like touched it. But...
Okay. All right. So now we're gonna palpate. All right. So please tell me if there's any tenderness or anything.
That feels a little bad.
Okay.
Hurts a little bit.
How about right there?
Yeah, right
Yeah.
there.
All right. What about that?
Yeah.
All right. How about any up here?
Not as much, no.
Okay. No. All right. So it's in this lower area.
Yeah.
All right. So I'm gonna come do some bimanual palpation in the liver. All right. So can I just have you turn this way a little bit? There we go. Is there any? No? Good. All right, I'm going to come feel over here. Okay. I'm just feeling for kidneys. I can't feel anything. That's good. And then I'm just going to feel for your spleen. Does that hurt a little bit? You have some distension in your lower abdomen. I'm going to do some shift dullness and a fluid wave test, all right?
Okay.
So I'm going to have you lay down. Okay. So I'm just going to start percussing from the down up.
That hurts a little bit, yeah.
That hurts. All right, so can I have you turn to your side real quick? All right. That hurts.
Yeah.
How about that?
Yeah.
All right, we have one more test and then we'll end it, okay? All right, so can I have you have your hand over here on this side? All right, I'm just gonna have my hand and I'm just gonna look for any like fluid. Does that hurt?
Yeah.
All right. All right, so you can sit up now. So I'm gonna go over the results of Kristen, and then we'll come back and I'll talk, okay?
Okay, sounds good.
All right, thank you. Hey, Kristen.
Hi, Tiana.
So I met with our patient John,
Okay.
and he was having a lot of pain. His stomach was distended a little bit, and he was complaining a lot. I didn't know if you saw he was guarding.
Yeah,
Yeah.
I did notice that.
Okay. So I came up with a few diagnoses. It was pain related to abdominal distension and patient guarding his abdomen, ineffective health maintenance related to unhealthy behaviors because of the alcohol he drinks and the spicy foods. What about, how do you think about those?
Yeah, I think those are good, definitely. And I've been thinking, I think we should make a referral to a gastroenterologist just so he can, get checked out by an actual medical professional
Yeah.
that's in that field, and they can make sure he doesn't have cancer, peptic ulcer disease, something more serious. And they can also further diagnose his pain. And I think we should also refer him to a nutritionist
Yeah, that sounds really good.
because of his diet, and maybe his pain would go away and subside if he, had a better diet, got more exercise,
Yeah,
didn't
that's
eat as much fried foods.
awesome. That sounds great. All right, so why don't we go talk to him?
Okay, sounds good.
Come in.
Hey, John.
Hi.
So based on our results and Tiana's exam, we've come up with a few referrals for you, and one of them is to a gastroenterologist, which is a physician who specializes in digestive system disorders to help diagnose your pain and screen you for any, further abnormalities. And also a nutritionist because we think that that'll help you have a more balanced diet and more exercise, things like that. So here are all the forms for you. All you have to do is call them. We already informed them, and follow up with us in a month, make an appointment so we can have everything checked out, make sure everything's going great.
Okay, sounds good. Thank you so much.
You're welcome. Have a good one.
You too.